The commissioner of the VI Department of Health says even though COVID-19 cases are high throughout the territory right now, we are transitioning from a pandemic phase to an endemic phase of the coronavirus pandemic. According to the latest numbers from the VI Department of Health, there are 901 cases territory-wide, with 362 on St. Croix, 518 on St. Thomas, and 21 on St. John. During Monday's weekly COVID-19 briefing, the health commissioner spoke about the importance of self-monitoring as COVID-19 moves from a pandemic to an endemic phase. As she explains, right now it's about self-monitoring and self-accountability.
In an endemic phase, a virus like COVID-19 will always be circulating among us in some form, much like the flu or common cold. Thus, some portions of the population will always be positive for infections whether they know it or not. Right now, while our numbers are high and transmission is likely, the department is asking everyone to become vigilant about self-monitoring and respond appropriately with mask wear and social distancing when in unsafe, crowded surroundings. Please become part of the community-wide solution by doing everything to keep yourself safe and healthy. Getting vaccinated and boosted, wearing a mask, socially distancing, and frequent hand washing is what self-monitoring is all about. It's evaluating your situation and reducing your risk. The decisions you make about your environment are equally important as those you make about becoming vaccinated. And yes, vaccines are still available, as I said, and testing once you feel sick.
The commissioner also said the Department of Health has aligned its guidance with that of the CDC when it comes to isolating and quarantining for those who test positive for COVID-19. People who test positive, regardless of vaccination status, must isolate for at least 5 full days and remain quarantined until there are no symptoms. Those who have tested positive can come out of isolation once they have been fever-free for 24 hours without use of a fever-reducing medicine like Tylenol. They also say you should take precautions for 10 days afterwards and wear a mask for the entire 10 days, especially if they are around people who are immunocompromised. And it's not necessary to retest for COVID-19 after coming out of that isolation period.